talking myself and going. So basically, as you see, I am Indian and I am Indian doctor. I am a cardiologist by specialist. But when I was, because I didn't finish my cardiology final exam, in the course I was thinking what I am doing. I will be one of the many cardiologists in the city. So that's why I wanted to do something new, innovative. At that time, it was like 10, 12 years back. IT, obviously in India, it was booming, so I want to mingle both, transform healthcare by IT. So that was the idea, and then I went to Norway to do my master's in e-health and telemedicine. From there, I got started into how we can use information technology for healthcare purpose and for various reasons. Definitely, I have advantage of being a clinician. I know the real problems of patients because although I have experience working like 7 years as a clinician. So I know what are the needs of the patients, I know what are the needs of the doctors, what are the needs of the hospital administrator. So I can see different lens to this. So that can be one of the advantage for you guys to ask more about the problems. Because what I see usually in conferences or in exposes, IT companies come up with wonderful idea, with wonderful device, and they only talk about this is very good, it collects this, it's very accurate, that's fine. But the question is where you are going to use this. That should be the main purpose. So let me just go forward with the slides, because as you see, it's all about health information technology enabled smart health care. By the way, I am working in Taipei Medical University, associate professor in biomedical informatics, and we have this center. We established this center because we want to focus particularly on health information technology. Because if I say I am from biomedical informatics, people think I am doing genomics, I am doing biology, I am doing other omics. But actually I am doing health informatics. I am dealing with the patient. I am dealing with the real data of the patient. And also I am working on social media. How we can use social media to benefit patients. And definitely I have another lecture about only social media research in healthcare, and we talk about what is good about social media, what is bad about social media, and what is ugly about social media. Because everything is not good. There are advantages, there are disadvantages, or people can use in bad ways. Anything, internet, you take. Same thing applies. You can use for applying, getting new knowledge, making new friends, or you can use for seeing pornography, seeing all those things. So it's all up to us. It's not the technology that should be blamed. It is you who should be blamed, or you should be taking responsibility. So our center is all about health, telemedicine. So definitely you have a lot of Chinese characters, so you can see what actually I want to do. We are doing this information, ICHIT. So this is the booming thing. And also what I want to say is, why we are sitting in this table, in this room here. If you imagine, this is all about time period. Time period means not 5 or 6. It's about the time we are living now. This time is dedicated for information technology. That is exactly why we are into this field. Doesn't matter who are you. You are engineer, you are advocate, you are psychologist, you are lawmaker, whatever. But still you have to use information technology. So actually I will be more focusing on India, but I am just providing a background of what we are going to discuss about. And then I jump back to India. Definitely you guys know about India. How many people, what is the capital city of India? Yes, everyone knows. Very good. So, we have like booming economy, and we have huge 1.3 billion population, little bit less than China. And actually, according to me, we have maybe much more but we are not even recorded there. So that's the reason officially we cannot claim we are the most populated country. And the reason why I am saying is everything starts from there. Even if you think of any precise target population for your company or for your device, maybe few tens in hundreds you get in Taiwan, but if you come to India, you get in thousands, hundreds of thousands. Simple example like you. If you want to do something about HIV/AIDS, I don't know officially or records, but maximum you may get like 10, 15 patients all over Taiwan. If you really go and search and extract these things, see, because you can't get more. But if you go to India, you get tens of thousands of, I am talking about very serious disease. In same way, if you are focusing cancers, of course there are a lot of cancers in Taiwan also, but again if you compare the scale, obviously you cannot compare 23 million to 1.3 billion. So there is no comparison at all. So that is one, just I am opening, exploring your minds. It is so huge. Whatever you want to do, you can do that. If you go for a dog bite, who in the city will be getting dog bite? You go to the Clinic of India where they take dog bites, you see long line of people with dog bites. I am giving just examples. So I want to insist is, whatever you do, you get large numbers. Okay, after saying that, again coming back to medicine. In India, without Indian medicine, healthcare is incomplete. That we should know. And whatever device you are making, because more or less, here we are gathering to develop a new model of business, new model of healthcare, or to help patients, or to help physician, or to help health management or hospital management. That is my assumption. The people who are sitting here. Also, Abdul, how do you think? We introduce or we want? I think that makes more sense, so that I know exactly what you guys want, and I can tailor my talk according to your needs. So please.
My name is Daniel, and I'm working on a cell and gene therapy platform.
I see. So, but is that a product or it is a service or what?
Oh yeah, it's a service for lab, for laboratory and hospital.
Okay, so they give you blood and you will provide you the information.
Yes.
Right?
Yeah.
I'm from local company, and we do rehabilitation system. Yeah, for use camera sensor and to detect the motion of patients, and we can do some training programs.
So all you guys are in startups, or you are already in company which is already established?
We are already a company.
How many years?
5 years.
Oh, so 5, 6 years, whatever. Yeah. Okay, so you have any real use case of what you are doing, like any hospital or any rehabilitation? How many patients?
You mean?
How many people are in? Patients.
Patients using it.
Yes.
I'm not very sure because we sold to hospitals. So.
To hospitals.
No, I mean 10
in Taipei.
In Taiwan.
In Taiwan.
Yeah. So I'm not very sure how many patients they use to use our system to the patients. Yeah.
So it's about rehabilitation, using sensors and cameras to improve the rehabilitation.
Yeah.
Hi, my name is Shabbir, and then I'm working for a company called Syed. we're doing cell therapy-based oncology treatment program.
Cell therapy. Okay.
Right, so we have two programs ongoing. One is universal CAR T, where we hope to use the allogeneic cell and engineer to treat melanoma. The second program we use DC cells, still immunotherapy, but using DC cell autologous to treat patients on ovarian cancer program.
And this, our company will do diabetes and self-management solutions.
Okay.
So we provide connected devices which can communicate by Bluetooth to also the platform for healthcare keepers use.
I see.
So we provide actually hardware and software. We don't do service. So we
No, this is very good, because one of my target is about diabetes self-management, but that is the point. Actually, whatever you think, some people are already doing it.
Yeah.
And this is very common, and it doesn't mean you should stop doing that or thinking about that. That's not the case. The only case is we can see how we can collaborate or how we can improve each other and stuff like that. So can I ask one concrete question of what exact service you provide? So suppose I am say 70 years elderly people living alone, just scenario I'm giving. And I have diabetes and I use your system. I am a user of your system. So what I get?
Actually, the diabetics patient, they need to have continuously careful management of their daily life.
Exactly.
Yeah, so they need to record all of their data, such as glucose level and also perhaps medication or insulin injection dosage.
Okay.
And also for carbohydrate intake. So all of this data need to be recorded well in their digital.
Yeah. So how you are helping to record their medication?
Yes. By using our connected device to simplify. Because now there are a lot of applications you can manually type in all the data, but still it requires the user to type.
Yes. That is the biggest problem, and patients doesn't type. They may type one day, they may type one week, but they
after 1 week they won't give up.
exactly. Yes. So how you are doing that?
So our device is like a sensor. So
But it's like a connect.
yeah, it's
Located in the TV. But the question is again, patient has to go front of there to take medication.
Yes, but they need, for example, for the medication, they just need to press on a simple button. So
Informing like they have taken,
yes.
but still they are inputting something. Okay, that is about medication. How about food?
Food, we are using an application so they just need to take a picture. So recognized by AI.
Okay.
For the
Are you focusing on their physical activity?
not yet. We are connected with Apple Health Kits, so we can get some physical.
The problem with Apple Kit or this is Google Fit, there are many things. But the thing is that when I keep here, that's it.
Right.
Always I should put in my pocket. But usually at home or I don't usually carry every time. That's one sort of.
That's what actually we are doing a pilot with Medtronic in US. They are testing on 200 patients with our devices, which is insulin recorder and Fitbit smart watch.
Okay, before I go into details, I have only up to 6:30, right? Sorry.
Maybe we can go into details and one consultation.
No, the reason I'm discussing was we really need to understand what we
Yes,
are
of
talking
course.
about. You are so brief then.
You know from AI Mate, and our system is focused on infertility medicine, and our technology is use AI technology and uptake technology to see if the embryo is good enough to implant into the uterus.
Okay.
They're also the team from Taipei, I don't know if it's right.
Yes.
Yeah, they're also from Taipei Medical University.
Okay. So I am also Taipei.
Yeah.
Good.
So,
Okay. Yeah, please. You are.
they're in the same company, so Ida from Motor AI.
Yeah, it's John from AI. We are making a wearable.
So you 3 people?
No.
Okay, these 2. Okay, you are separate.
Yeah, so we are making wearable device.
Wearable device?
Like a smart glass.
Okay.
And the use is focused on maternal care, especially for dementia and family issues.
Wonderful.
Yeah, we want to provide a device like a virtual assistant to them.
Okay, I got the point. Okay, so I will not go more details, so I will just what that was. So coming back to again, I will take back to India, which is very big country, and we have like 30 different states. Actually, see, each state has to be one country. That is the reality. No, this is serious, I'm serious. If you compare with Europe, this is exactly the reason. You see, Italy is different, France is different, Germany is different, Hungary is different. But in India, Madhya Pradesh, Uttar Pradesh, no, people not even know the name of the state. Because they only know India, big figures, that's it. But each state is different, one separate country and much bigger than European countries. Each state I am talking about. And there are 30 of them. So you can understand the scale. So then I was saying, and also it's very, very important, whatever you want to introduce in India, you need to know what is happening in India. What is the healthcare system there? Who is paying to whom? And what is the role of government? What is the role of insurance companies? And what is the role of out-of-pocket payment? So this is very, very important. And then also you should know how Indians get treatment. They only go to Western hospital, or they go to Indian hospital, or they do what, or they don't do anything, whatever. So Ayurveda is 5000 BC medicine. Definitely everyone knows about Ayurveda. Ayurveda is very ancient Indian, just like Chinese medicine. But the good thing of Ayurveda, Ayur means life. Veda is science. Science, actually, yeah, science of life. They don't talk about diseases. They talk about health. And this concept is 5000 BC. That is what I want to focus on. Here in Western medicine, we only focus on curing. We focus on treatment. But in Indian medicine, we more view for prevention. We more focus on how to avoid diseases rather than treat diseases after they are there. That is very, and also there are homeopathy and there are Unani. These are the various different things. And definitely after 19th century with specialization, all those things, from this we went to this. So that's how, yeah, we are transforming. The problem, the advantage of Western medicine is quick results. You take 1 hour, your headache go. You take this and within 1 hour, whatever problem you have, it's gone, if it is effective, definitely. But this is not like that. It works slowly. That is the reason we use for prevention. We don't use for curing. And model of healthcare. This is very important. We have a public system, private hospitals, and charity and missionary. Actually, charity missionary are something like public, but these are maintained by some trust. Some rich people, they want to start hospital in the name of their mother, in the name of their father. They just start hospital and they start paying for all people who wants to get treatment. There are many such. Missionaries like Christian missionary are there, so many, and there are so many trust hospitals belonging to different region and religion. In India, religion, caste, this play a very important role. Unfortunately, I don't belong or don't believe all these things, but that is the system there. Still, there are religions, caste, all those things. And what is different between is the public is like by state government and it caters more or less 20 to 30%. But the rest of the 70% goes to the private. Again, there are primary, secondary, tertiary levels in both. I think I have shown them. Yeah. Clinics, nursing homes, primary care, secondary hospital, tertiary hospital. These modes of healthcare delivery are available both in private sector and public sector. This is also important. And then these are the things actually I can present much better than anyone because health is the third largest growth segment in India. Because first is like food, definitely. No, if you see communication, education and health. This is by number, this is by percentage of increase. You see? So first is obviously mobile phone, smartphone, telecommunication companies. They are earning a lot of money and investment. Next comes education and third is health. Health is the third biggest, largest growth in India. That means lot of opportunities available for new companies to penetrate into Indian market and see what they can play the role with. Again, investment in India. This is like occupying again top left investment needs of healthcare sector are comparable to other infrastructure sectors. So if you see power, telecommunication, road, so this is not bad. Healthcare is also need a lot of reaching. You see, healthcare in India will grow at 10% annually to reach $190 billion. That means lot of money is poured into healthcare system. These are the very important things because if a country is not interested in healthcare, then no matter what solution you are preparing for that segment, it doesn't work. But if they have these large opportunities, investment, then definitely you can play a big role in this type of segments and in these sectors. And again, share of the wallet. Share of the wallet is out of pocket. This is one bad thing which I don't like, but this is the fact. People pay out of pocket. So they don't want to go for insurance. They only pay when they get ill and they pay so much that they need to sell their household. That is the problem. And one member of family get ill, all family has to suffer. Because they need to sell. If they have cows, they need to sell cows. If they have land, they need to sell land. Because the procedure is very costly and if they go to public, chances of aligning is less. So they have to go to private hospital. And definitely private hospital take lot of money. It's not like they are just taking, it is the cost. It costs that much. So they have no other option. They have to sell things. But still they want to do same thing. Because for me, the best way of healthcare is like in Taiwan. It has to be insured, a third party should control, because in India, I am a clinician as I told. I should not say these things, but I want to be fair with you guys, because doctors prescribe so much. Doctors prescribe unnecessary medications. Because if they prescribe more, they get some commission from pharmacy. If they prescribe more blood investigation, they get some commission from lab people. This is the way they are working. But if you see any developed country or perfect nice country, healthcare should not be business. It should be a service. Because everyone has right to live and right to be healthy. That state has to declare like fundamental rights, but it's not happening in India. Only who are rich, who can capable, they are living. And their efforts to live. Those who are poor, they can't do. They die only with simple infections because they need to buy antibiotics. From where they get antibiotics? And the cost of antibiotics is going higher and higher. So this is the scenario. But again, if you are coming into it, so what role you are playing? Number one, definitely unless until you became rich, you cannot take care of poor people. So first thing is you should make money, then whatever you want to do, that's up to you. To make money, obviously, even if I say like 20% is rich, 80% is poor, 20% make 200 million population, which are very, very rich. 20% are really, very rich. Then you need to focus this 20%, that is 200 million. Even if you want to focus healthcare, elderly population. Of course, India doesn't have a problem like in Taiwan, because people really don't live so long there. They die in 70s, somewhere early 80s. But in Taiwan, no. 80 years old ladies, they do U-biking. No, this is serious. I really appreciate it. I love that. And you see early morning in the park, all elderly people doing all sorts of exercises, dancing, all those things. That is the way we should live. But this is very far in India. In India, it's not like that. But still, if you want to focus on elderly, you get millions of elderly people. Millions of elderly people. Although they are less in number, but still you get. That is the point. So there is not any sector that you say, okay, these patients are less in India. There is nothing less in India. Everything is more in India. And growth drivers. So as I told you, like India is now like second fastest growing major economy and third already economy. So we want to beat, obviously, always we have competition with China. That is the fact. So we want to take over China, but of course China is doing much better. I should accept it. But no problem. We don't give up, we will be working together. And then Indian healthcare has emerged as one of the largest service sector in India, as I told, and healthcare spending in India is expected to rise 15% per annum. Every year, people are obviously becoming a little bit rich, and they are spending more on healthcare. As I told you, this is from out of pocket, so it's you can't even count. So many billions of money are poured into healthcare. And in Taiwan, it's very simple. You say, okay, 6.78 GDP percent national health insurance is using. So everything is calculated, estimated. They know all. But India, it's not like that. People are paying themselves. So it's very hard to capture, but that is how it works. It's good for new companies, new models, because if you manage to convince hospital or anyone, your customer, that this is more economy and more patients will be coming. Recently, I had a talk with one Lincolnix, I don't know what is the name, one Taiwanese company. They provide patch and they collect ECG from the patch. And they wanted to know exactly same thing. What is the option of India? I told definitely there is an option. You can go and you can put, you forget about poor people, you only select executive medical checkup. Obviously, even if I talk about 10% who are interested in doing this executive health checkup, you use this patch, say, I am recording like 3 days of your ECG and I can know everything of your heart, people will be ready to pay you. That is like one example. See, because it is out of pocket, 12% of GDP and it was in 15, like almost 3-4 years back. And every year they are employing like 9 million new people into healthcare sector. And this is the way of healthcare service demand in India. This is very important. If you are business oriented, you should see what is the demand, service demand. More is public care. You can't do much in tertiary care because already high-fi developed protocols, medicines, equipments are there. So if you really want to focus, please focus on this. Primary care, the basic health facilities for common minor elements and where prevention is most effective. This is the key I can say. And obviously 90% patients need primary and secondary care. Only few people will go up to this level. So please, whatever you want to do, try to play here, unless until you have very specified, like you are saying, like you are working with immune therapy of some cancer, perfect. This is exactly where you can go there. But people who are working like you with diabetes, management, self-management, self-empowerment, all this comes here. And you should know, India is a diabetic capital of the world. So you have millions of diabetics because of the culture, because of the food, because of all these things what we do there. So that is really fantastic. And if you see, again, urban is maximum concentration of corporate healthcare service providers, and rural they need much more because these are the villages. So definitely they lack healthcare services, but in urban they have huge things. So definitely, again, you need to work, come up with a plan where corporate healthcare system can use your system. That makes more sense and more easy to penetrate. And again, areas of opportunities like health service, outsourcing. Actually, we have, okay, I am talking about telemedicine also, medical tourism. I don't see here, but medical tourism is another big market in India. And I will be, personally, I am interested in medical tourism, taking patients all around the world back to Taiwan. Oh, sorry, Taiwan and India. Because in Taiwan the problem is national insurance, so you really don't need to pay. And if you want to pay, you will pay huge amounts. So that really doesn't make sense. But if anyone wants to have world-class treatment with very economic budget of health cost, India is the destination. And definitely telemedicine and clinical trials. Why clinical trials? Because of population. What type of disease in which stage you want, you will get there. So there is no limit for samples. Whatever you want, that's why all big US companies are back of India. They come and they want to recruit patients and do all different sort of experiments or clinical trials. And obviously there are a lot of different things happening in India. So just I give some examples. Here is about health record. So this guy is working with Swasthya Slate. Slate is like pad. Slate means pad. Swasthya means health. So health pad. They call it health pad. And again, this is connected with various devices. And it's instead of using phone, they want to use pad so that they can clearly see and interact with the patient and all those things. And then PPP will enhance. Anybody know what is PPP? Mostly people from developing countries will be knowing. This is public-private partnership. Actually, in Taiwan also is there. There are a lot of hospitals. Infrastructure is provided by the government, but the service, management, everything is done by a private. For example, if you take one farm hospital, the building belongs to government. But management, doctors, nurses, all staff belongs to TM. So this is PPP. So public-private partnership. So now, before I was talking about there is public sector, there is private sector. But now government become more smart. They are unable to run the hospitals. Although there are big hospitals, so big in area, but they cannot manage. That's why they give it to what they call capitalism. They open it for public, and anyone who is interested to run, they say, okay, I have this big area, I will be giving you, but you should run in a hospital. And you cannot charge much higher. Then they negotiate how much you can charge, because you will charge how much you need. You cannot charge like endlessly to like private hospitals. So PPP is best model that works very well. So that is the one of the principle you can think about. Okay, how about I get into public-private partnership? That means you take your device or your system and work with the government hospitals. Government will pay you, but not like private, but still you will have huge number of users. That is the key. You have millions of users. And yeah, these are the cost-effective, higher productive, accelerate delivery, clear customer focus, enhanced social service, recovery of user charges. So these are the advantages of PPP. So you can also focus this model of business. And this is actually National Health Portal of India. You can just go Google this or go to like NHP, National Health Portal. .gov.in, then you will get lot of different things, what's happening in India, what awareness program they are having, what insurance they are providing, what health these things, various things. This I just show you, it's not like nothing is happening in India, no. So much things are happening, but still you can play a big role in Indian market. And again, Swasth Bharat means healthy Bharat. Bharat is another name of India. So Healthy India mobile application. So there are a lot of national health portals. They provide various things for various people, but again, it depends from state to state, city to city, and the system environment, and also background of the patient. If he is rich, he don't care all this. He just go to big hospital, better hospital, and get treatment. And that is one of the problems. Even in India, or I don't know how it is in China, but usually patient think, my health issue, problem is not my problem, doctor's problem, my doctor's problem. He will take care of what is never happening to me. That is the point. I go and complain. That's it. He will fix it. That is totally wrong. That is where we come up with new technologies to empower the patient, to make him participate in healthcare. That is what I call participatory healthcare. So we want patients to take part in their own health. They need to understand what is happening, what is diabetes. What generally people know is, okay, sugar is high, I should not eat sweets. Only two things they know. And they don't know how this occur, why it occur, what they can do, what they cannot do, how they should, what are the complications of the diabetes, they really don't know. But if we make a system, actually I am proposing one of the project which I told, that is precisely on participatory care on diabetes. Actually we call it artificial intelligence for diabetes. So we collect data and we provide prompts to them, but there we are not collecting. That was the reason why I was asking her details. We are not collecting the food habits, we are not collecting the push button for medications. We are more focused on physical activity and sleep quality. Yeah. So yeah, thank you. So here is my email. And now I think that's good. I